Hello and welcome to my channel Medicine with Dr. Moran. Today I want to talk about beta blockers and what patients actually need to know. You or a family member or friend are likely taking one of these medications because beta blockers are one of the most versatile medications in medicine and millions of people take these every day. They're banned substances in sports that require fine motor control like golf. Imagine being over a putt to win a major championship or a lot of money, or just bragging rights with your friends. The adrenaline's flowing, you're nervous, the hands are sweaty and shaking. Then the putt misses. Beta blockers improve that situation by blocking adrenaline. Of course, not every missed putt is due to someone not controlling their emotions or adrenaline. There are many drugs in the beta blocker category. Now, the generic names or active ingredients all finish with the OL suffix. Some common generic examples are Metoprolol, Bisoprolol, Atenolol, Nadolol, and Propranolol. I was always taught, and I think it's proper, to refer to the drug by their active ingredients or generic name, rather than the name that the pharmaceutical company gives to their product to make it sound great. You may know the pharmaceutical names. They're called Lopressor, Toprol, Zebeta, Tenormin, Corgard, or Inderal. Beta blockers block adrenaline receptors in different organs of the body, which reduces the effect of adrenaline. Another word for adrenaline is epinephrine. There are many reasons why beta blockers get prescribed. They can be used to treat chest pain for blocked coronary arteries, a condition that we call angina. We use them to lower the risk of death and improve symptoms in congestive heart failure. They're often used after heart attacks to prevent future events. They're also used to treat high blood pressure. In fact, one of our earliest blood pressure medications were the beta blockers. We use them frequently to prevent and treat rhythm problems with the heart. One example would be slowing the heart rates down of rapid heart rhythms such as atrial fibrillation. They're preventative medications for migraines. They're also used to prevent symptoms of overactive thyroid conditions. Many patients take topical beta blocker drops for their glaucoma, which is a condition where pressure is increased inside the eye. They can reduce certain types of tremors, and that last reason is why beta blockers are banned, as I mentioned earlier. Now, who should avoid beta blockers? If you have a slow heart rate or low blood pressure or poor blood flow to your arms and legs, as well as asthma, those are usually the main reasons. On rare occasions, people with chronic obstructive lung disease, otherwise known as COPD or emphysema, people can have side effects from beta blockers, and we may take them off that, but generally they're well tolerated in that population. Now, if you're on a beta blocker, what do you need to know? These are medications which are adjusted to improve your blood pressure or your heart rate. And I may use the term pulse, which is something that you feel when you put your fingers over an artery interchangeably with the heart rate. Now, if your heart rate's in rhythm, when your heart beats, you will feel a pulse, and the heart rate number will actually be the same. Only if the heart beats earlier than normal, such as with a premature beat or with a rhythm disorder, there may not be enough blood in the heart when it prematurely pumps to generate a pulse that you can actually feel. And so the numbers can be different, and the pulse will actually undercount the true heart rate, something I see every week in my office. Beta blockers reduce your blood pressure. They definitely reduce your pulse rate. A normal pulse or heart rate for people at rest, not on any medication to affect the heart rate, is 52 to 90 for most people. Now, we often titrate the beta blocker to bring people's pulse down into the 55 to 60 beats per minute range. And obviously, people that already have a pulse in the 50s, we avoid beta blockers because their heart rates would simply get so low that they may feel dizzy or lightheaded because their blood pressure or blood flow to the brain is not sufficient. And in fact, if it's really severe, it can cause people to black out, a condition we call syncope. So the bottom line is, if you're on a beta blocker, you should be checking your blood pressure and your heart rate as your doctor has told you. And this is very important. I can't emphasize this enough. If your heart rate is consistently below 55, the beta blocker dose can be reduced. I do often tell patients that with time, over the next number of years as they age, often the heart rate actually will go down slowly, and the dose often will need to be reduced in the future. In other words, keep an eye on your heart rate. Now, slow heart rates are called bradycardia. I do have a video on my channel on how to check your blood pressure, and you can click the link in the description for more details to watch it. In terms of your heart rate, you will get this when you check your blood pressure. But if you want additional readings with heart rates, you can get this if you've got a smartwatch or activity tracker. The smartwatch will actually tell you your resting heart rate, your heart rate during sleep, as well as your exercise heart rate. And these numbers can be very helpful for you and your doctor when adjusting or titrating your medication. Some smartwatches, of course, will allow you to do an ECG. This can be quite helpful if you do have heart rhythm problems or palpitations or lightheadedness, and you wonder what's going on with the heart rhythm during that period of time. You simply open up the app and put your finger on the crown. There's other ways of using the watch in a good ECG signal, but that's the way that most people tend to use it. Of course, getting an ECG done when you're having symptoms can be helpful, and many of my patients bring in their watch. I've got several in their 80s actually bring in their phone and show me on their phone what their rhythm was doing when they had symptoms, and that can be quite helpful at making a diagnosis. People wear their watch all the time, whereas we can't always send them home with monitors for them to wear all the time. And so that's a whole lot easier to just check the ECG when you've got a watch on your wrist. They're becoming so much more prevalent in society now because there's so many different applications you can use on a smartwatch that many of my patients, even in their 70s and 80s, actually have one of these devices now. It is very important that you do not stop taking beta blockers suddenly. This is one of the drugs that need to be tapered in medicine. When that occurs, if you stop it abruptly, your body will feel the effects of more adrenaline, which can cause your heart to go faster and your blood pressure to go up, and in rare cases can cause things like a heart attack. It's important that you know that these medications need to be tapered over the span of a few short weeks based on your physician's instructions. In fact, if you're coming off any medication, you should ask your physician if it needs to be tapered. With beta blockers, if you stop them abruptly, as I mentioned, you get unopposed adrenaline binding to the adrenaline receptors, which then puts up your heart rate and blood pressure and can lead obviously to an increase in tremor and irritability and the heart going out of rhythm, or an increase in symptoms the drug was being used for, such as chest pain. Rarely an abrupt withdrawal of a beta blocker can, in patients with blocked coronary arteries, lead to a heart attack, and I have seen that a couple of times in my career. As these medications can reduce blood pressure, sometimes people will feel lightheaded or dizzy when you get up from sitting or when you get out of bed in the morning. It's particularly prevalent in elderly population. Now, in that case, you want to rise slowly if you've been lying down or sitting. If you do have these symptoms, you can actually investigate this by checking your blood pressure sitting, then 1 to 2 minutes later standing, and 5 to 8 minutes later standing. You will look to see if there's a drop in the blood pressure with standing, and typically the drop will be more than 10 millimeters of mercury if you have a change. Now, if you have diabetes, blocking adrenaline will reduce some of the symptoms you might get of a low blood sugar. When people who have low blood sugar, which we call hypoglycemia, the symptoms you tend to get are tremor, irritability, sweating, anxiety, headaches, palpitations, and even weakness. All of those are induced by the release of adrenaline to try to bring the blood sugar up. These symptoms can be reduced significantly by the beta blocker. So if you have diabetes or hypoglycemia, talk to your doctor about using your beta blocker. If beta blockers are being used for high blood pressure, it's also important to avoid over-the-counter things that could raise your blood pressure. You may not know that cough or cold medications, anti-inflammatories like ibuprofen or naproxen, decongestants, diet pills, other stimulants can bring the blood pressure up. Always let other doctors, nurses, dentists, pharmacists, or any other allied health professionals know what medications you are actually taking, particularly beta blockers. Always have a list of medications with you. It's something I see every day. Somebody doesn't bring in their list. Consider making a list as a wallet card. Take a picture of the list on your phone. Record them in your notes application or in your medication application on your phone. Many people who are referred to me by other consultants or family physicians, They can't tell me what medications they take, the amount, the frequency, or even the names. And medications are so important in medicine because a lot of side effects or complaints that people have are actually directly related to their medications. So we need to know what you're actually taking. Now, the review of medications is important to ensure that you're not taking medications you don't need, or that drugs are causing side effects, as well as to ensure that you're on the optimal doses of the medication that you actually have. When you start on a beta blocker, it's important to report any symptoms that you might get to your doctor. So what symptoms might you get? Well, sometimes symptoms, of course, might be coincidental and related to something else that's going on, but it's still important for your doctor to evaluate. Now, what are the common side effects? I've already mentioned a few. One would be low blood pressure or slow heart rate. And of course, they block the adrenaline response in diabetics when the sugar's low. Beta blockers can increase resistance in your breathing passageways, your breathing tubes. So in people with asthma, they may get more short of breath. Infrequently, as I mentioned, it can make someone with emphysema or COPD a little more short of breath, although generally it's well tolerated in that population. It can also cause cool extremities, such as cold hands or cold feet. Or if you have these symptoms, it can make them much worse. In about 1 to 5% of people, beta blockers make them feel fatigued. It's something I see quite commonly because I use beta blockers a lot. Sometimes people can have difficulty sleeping, rarely vivid dreams, or even reduced mood. Now, the neurological effects that I just mentioned generally go away with a dose reduction or discontinuation, so please mention them to your doctor. Now, rarely beta blockers can cause erectile dysfunction. A review of 8 randomized trials of beta blockers versus placebo in patients with high blood pressure did reveal an average increase in body weight of 1.2 kilos, which is 2.5 pounds. The range of the weight gain was from a weight loss of 0.4 kilos to a gain of 3.5 kilos. GI symptoms are possible. Abdominal pain, diarrhea, constipation occur in about 1 to 5% of people. If you have serious allergies and carry an EpiPen, which has an epinephrine, which of course is another word for adrenaline, beta blockers will reduce the effectiveness of that EpiPen. And of course, EpiPen is a life-saving therapy. And we avoid beta blockers in that situation. That's an important thing to know if you've got an EpiPen. We generally avoid beta blockers during pregnancy because they do cross the placenta and thus the fetus is exposed to the beta blocker. Studies have shown conflicting results in pregnancies, and so beta blockers are not used unless there's a very, very compelling reason. Beta blockers are excreted in breast milk, and so we generally avoid beta blockers unless there's a compelling reason in this particular situation. Now, how are beta blockers metabolized? They're actually broken down in the liver. Now, they are safe to use in liver disease, and we often use them in liver disease to bring blood pressure down in the abdominal organs. Now, in that instance with liver disease, we start the beta blockers at a low dose and we titrate the dose to the effect. If you've got kidney disease, even if you're on dialysis with no kidney function, no dosage adjustment is necessary. In summary, beta blockers are very versatile, highly effective medications for lots of different medical situations, as I've entailed in this video. They come with risks, as I've pointed out. It's important to remember that every intervention we do in medicine, whether it's a medication or other intervention, has got risks. We try to balance the risks and the benefits to do the right thing. It's important for people who take beta blockers to understand the risks as well as the benefits that I've mentioned. Knowing the potential side effects of medications that you're taking, it's very helpful so that if you do develop symptoms that might represent a side effect, you can bring these up straight away with your physician. Thanks for joining me today on Medicine with Dr. Moran. I'm Dr. Keith Moran. And remember, get healthy and stay healthy.